Basics of Research by Dr. Jayaprakash Muliyil, Professor of Community Medicine and Consultant, Division of Gastrointestinal Sciences, Christian Medical College, Vellore. Dr. Jayaprakash has completed his undergraduate studies in medicine and postgraduate studies in community medicine from Christian Medical College, Vellore, and joined the Faculty of Community Health over there. Sir was in charge of the leprosy control program. In 1985, he went to Johns Hopkins University at Baltimore, from where he has completed Masters in Public Health and Doctor of Public Health in Epidemiology. From 2002, he has served a 5-year term as the principal of CMC Vellore. He is closely working with the Government of India on various health projects and was also a member of the Scientific Advisory or Strategic Committee of several national and international institutions. Professor Muliyil has published over 160 papers in international and national journals. I now request
Thank you for the introduction,
to take over his session.
And it will be a truly magical if I can explain the basics of research in 20 minutes. I will not attempt it. But I know many of you are lingering on the outskirts of science, wondering whether you are eligible to take a stride in with those great luminaries who are doing research and traveling all over the world, publishing their papers. Now, the thing I want to focus on is the fact that about our 1930s, medicine was by and large an observational science. Observational science, I mean, they made very careful observation of everybody who came sick, measured the temperature, checked the pulse, and described everything extremely carefully. But when come to intervention, cure, hardly any scope. Not so today. We have made great strides, not only in medicine, in every walk of human life. So what has changed the world altogether is scientific inquiry. And that inquiry-driven lives of many people have contributed positively to our quality of life today. We have conquered illnesses, we have extended our life expectancy, child mortality has dwindled, and we are grateful for all these things. And remember, we are just keeping up with the growth in science in every field. We are no exception. Now, health-related research, or what do they call epidemiology? I don't know. When I got a doctorate in epidemiology, if somebody asked me, who are you? And I introduced myself as an epidemiologist, they would not know what that means, okay? Many people thought that was something to do with epidermis, so they thought I was a skin doctor. But COVID has changed it all, and science was there in the newspaper all over the place with all kinds of rates and ratios and solutions to problems and various kinds of that. Now, 30s and 1930s and 2030 is going to be extremely difficult. Now, the question is, who should do research? And this has been coming up again and again. They introduced me as formerly the principal of Christian Medical College. And I was a student in Christian Medical College. We had a fantastic principal, very lovable, brilliant surgeon. And he used to tell us, those who can operate will operate. Those who can't will do research. In other words, in his opinion, this kind of a research is a hobby. Fortunately, I have changed my mind from that, and I think it is integral part of existence. The important thing to remember is all of us are born with the skills for doing research. And the quality is very simple, basic inquisitiveness and a little bit of common sense. If these two things are there, you can do research. And many things happen because of this curiosity. I do understand our educational system from class 1 onward tried to stifle this inquisitiveness. Okay, and that thing, I don't know when it is going to change. That whole question of suppressing curiosity. Listen to the teacher and repeat what he or she says has become the kind of a watchword of education. But this kind of a transformation in undergraduate, in school education is necessary to prepare ourselves so that we don't lose our natural born, natural instinct to be curious and research driven. So my point number one is very often we are lost our skills during our school days when we were preparing multiple choice exams to get into medical colleges. We have lost our skill to be imaginative. Now this is a common disease all over. So when you start encouraging people to research, there's a lot of hesitancy. Maybe I'm not qualified for it. No such thing. I want to tell you a story of a man who made a big difference to human life. It is Edward Jenner. You have heard of him. He was a doctor, born in 1700s in England, but he made a singular observation. What was his observation? His observation was that certain type of girls are prettier than other girls. And who are these pretty girls? In his opinion, generally, those girls, they're called milkmaid. They sold milk because they are working with dairy farms and they sold milk. They had a better countenance, better complexion. The skin was better. They were looking better. So he said, why are they different from other girls? And it came to him in a flash, what could be the reason? Remember those days in England, epidemics of smallpox used to come frequently. Apparently, these girls somehow were protected from the smallpox. And that his observation led to the discovery of a vaccine for smallpox, which thankfully we have been able to get rid of. Now, there are people qualified to do research, but why should a nurse or a lab attendant or a doctor working in a small clinic be interested in research? You may ask this question. But there are two reasons why everybody should be aware of research method and the ability to interpret what the scientists tell you to do. Should you follow it? And there is a reason, because we have a peculiar situation in healthcare, which is not found in probably engineering or even agriculture. And this is exemplified by this little story by George Bernard Shaw. He was talking about a town where the hangman and the judge were the same guy. Okay, so he had a dual role. Sometimes he was the judge, sometimes he was the hangman. So prisoners were brought to him for the sentence. And if he said prison, they'll go to prison. Hang them, he'll be hanged. But unfortunately, the guy was paid only for the number of hangings he did. Okay? So what do you think this man would be tempted to do? George Bernard Shaw asked this question. In the case of doctor, you have the same dilemma. For an ingrowing toenail, you may charge 50 rupees, but just to remove the nail. But if you do a below knee amputation, you may get 5,000 rupees. So what would the prescription of the doctor be? The problem is gradually medicine, which was a benevolent enterprise, has become a business enterprise. So we have a problem now. We come across these issues related to evidence-based medicine and protocol-driven management. Now, he who decides it, does one size fit all? Or do you, as a physician working in a village, know better about the village and the appropriateness of management in that context? And that is being taken away. So I think it is not just some people who do research, but those who are not actively involved in also need to look at research and understand the applicability in his or her situation. And that is why encouraging you to learn about research method, I do it with passion, because very often you stop learning after the course of medicine is over. No, for us, those who are in health profession, doctors and nurses, learning is a continuous process, because we are obliged to do that. We have a responsibility to the community, because we are just not health provider, we are guides for their livelihood and their health. Now, I'm going to tell you a story that happened in the United States to show the importance of looking at science and healthcare dispassionately. There was this study done in the US many years ago, and at that time, one of the commonest surgeries done in North America was tonsillectomy. So this particular researcher, I don't know, this study doesn't have a name. You learn study designs and various names, but this guy did this study, and it is very peculiar and unique. He got a number of children and showed them all to an eminent ENT specialist and asked him to look into the throat and decide who should have tonsillectomy. His doctor examined and carefully noted down and declared about half of them required tonsillectomy. So they took the half children who were not required to have surgery and took them to another famous ENT specialist and asked him, will you examine the throat and suggest what they should do as far as the throat is concerned? He too examined these children who have been rejected by the first surgeon, and this guy said half of them require tonsillectomy. So the group that remained, not requiring tonsillectomy, after two surgeons examined them, were taken to a third equally famous ENT surgeon. He examined carefully and declared that half of them required tonsillectomy. Now, it looks like if you see adequate number of ENT surgeons, you will lose your tonsils. But what followed the study was very miraculous. Tonsillectomy rates in the United States fell drastically. So you may hear of all kinds of p-values and all kinds of complex statistical analysis. But what is important? Common sense to interpret these things. Okay? Now, clothing it in very sophisticated words should not fool you. Use your sense of what is right and wrong, and I'm sure you will be able to contribute. Whatever comes in your way is important information that you get. We learn from our patients and those who come to us with the patient. And from these learning, we give back to the society. Not everything need to be in the form of a great article. Your own teaching, your own practice will improve from what you learn from around people around you. I wish you the very best.
Thank you, Jayaprakash sir, for the insightful talk.